Hello everyone, welcome back to the channel. In today's lesson, we are going to explore the anatomy of the thorax. The thorax is much more than the chest. It is a protective cage that houses some of the body's most vital organs. By the end of this lesson, you will understand the boundaries, skeletal framework, contents, function, and the clinical importance of the thorax. Whether you are a medical student, nursing students, or interested in human anatomy, this lesson will strengthen your understanding of this essential region. The thorax, commonly known as the chest, is the region of the body located between the neck and the abdomen. It forms the upper part of the trunk and encloses the thoracic cavity. The thorax protects delicate organs while allowing enough flexibility for breathing. Every breath you take depends on the coordinated movement of the thoracic cage, intercostal muscles, and the diaphragm. The thorax has four main boundaries. Anteriorly, it is formed by the sternum and the costal cartilages. Posteriorly, it is formed by the 12 thoracic vertebrae, which provide support and protect the spinal cord. Laterally, it is enclosed by the 12 pairs of ribs and the intercostal muscles, which help expand and contract the chest during breathing. Inferiorly, the thorax is separated from the abdominal cavity by the diaphragm, a dome-shaped muscle that is the primary muscle of respiration. Together, these structures form the thoracic cage, which protects the internal organs while allowing the chest to expand during inspiration. The thoracic cavity contains several vital organs and structures. The heart lies within the mediastinum, which is the central compartment of the thorax. On the other side of the mediastinum are the right and left lungs, which are responsible for gas exchange. The trachea carries air from the upper respiratory tract into the lungs. The esophagus passes through the thorax, transporting food from the mouth to the stomach. Major vessels, including the aorta, superior vena cava, the pulmonary arteries and veins, also pass through the thorax. In addition, important nerves such as the vagus nerve, phrenic nerve, and the sympathetic trunk travel through this region to regulate the heart, lungs, diaphragm, and other thoracic organs. The thorax provides attachment sites for muscles involved in breathing, posture, movement of the neck, back, shoulders, and upper limbs. Finally, it serves as a passageway for major blood vessels, nerves, and the esophagus between the neck and the abdomen. Let's look at the clinical importance. Understanding the thoracic anatomy is essential in clinical practice. Fractured ribs can damage the lungs or nearby blood vessels, potentially causing serious complications. Conditions such as pneumothorax, where air accumulates in the pleural cavity, can cause the lungs to collapse and require emergency treatment. Diseases like pneumonia affect the lungs and impair oxygen, while heart attacks such as myocardial infarction, commonly known as heart attack, occur within the thoracic cavity. Healthcare professionals also rely on detailed knowledge of the thoracic anatomy when performing procedures such as chest tube insertion, cardiopulmonary resuscitation, and thoracic surgery. Conclusion, let's recap. The thorax is the region between the neck and the abdomen. It is formed by the sternum, ribs, thoracic vertebrae, intercostal muscles, and the diaphragm. It protects the heart, lungs, enabling breathing, support muscle attachment, and contain vital organs. A solid understanding of the thorax anatomy is essential for diagnosing and treating medical conditions. If you find this lesson helpful, please like the video, subscribe to the channel, and share to your classmates. Thanks for watching. I will see you in next anatomy lesson.